There's a new survey out there that finds 3 out of 4 Americans believe mental health takes a backseat to our physical health. Here to talk about that is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. Good to see you, Doctor.
Hey, Dr. Alice. So let's give some context here. 1 in 5 Americans is currently living with a mental illness of some kind. But according to this survey, nearly 60% of Americans give a poor or failing grade to how mental health conditions are treated. So what kind of grade would you give the system here in Massachusetts?
So in Massachusetts, there are some things that we do really well, and there are some significant limitations. Access in Massachusetts is much better than in a lot of other states. There are a lot of mental health providers in the area, and our version of Medicaid, MassHealth, covers a lot of mental health services. But there are some systemic issues. So insurance tends to reimburse at a pretty low rate when it comes to mental health services, which pushes a lot of mental health providers into private practice, making their services cost prohibitive for a lot of people. And then there's also disparities in access based on insurance type, income, and race. And a lot of times what this looks like is less choice in provider and less likely to find a provider with a similar lived experience.
So, Doctor, right now, in your opinion, why are so many people having a hard time getting the help they need?
It's really a supply and demand issue. So there has been a huge improvement in the stigma that people feel around accessing mental health care in the last 5 or 10 years, which is wonderful. And it means that more people are seeking services from a workforce that hasn't quite caught up to the demand yet.
So, Doctor, what else can we add to the conversation right now? Are any of the problems easy to fix?
Unfortunately, a lot of these problems are pretty systemic, so they're not super easy to fix. But there have been some really positive developments, especially in Massachusetts. So I'll give you 2 examples.
Yeah.
One is that the Commonwealth has created a couple of programs to really increase the mental health workforce, which has been amazing and is going to do such a great thing for increasing the supply of providers. And the other is that they created a program for peer support specialists that is also going to increase the workforce, but is also going to diversify the workforce because it's more people of color, more people with lived experience of mental illness or addiction, and more people who wouldn't necessarily have access to graduate education.
All right, Dr. Connors-Kellgren, thank you so much. We always appreciate it.
Thanks,
you.
Doctor. Take care. Let's take